me, the senior staff have always been people I've gone to for advice, for clarification, for questions when I'm unsure. Advancement to level 2, to me, signifies that I've now become one of these senior nurses, that I'm someone that the newer nurses are coming to looking for advice, looking for, pick me up, looking for some encouragement, stuff like that.
Professional advancement means that you get to be more of a resource on the unit, and newer nurses look to you if they have any questions or if they want to develop professionally. And it also means that you get to play a more active role on the unit. So you get to be in more committees, and leadership looks to you to kind of help make the decisions on the unit.
Personally, professional advancement, it has a level of pride in my practice, as well as validation of the work that I had been doing for years on a day-to-day basis. I would say that it means that it makes you more of an expert in your field.
It means to me that I've come quite a long ways from when I started here on 7 South 6 years ago as a new grad nurse. I recognize my skills and abilities have come a long way. My clinical judgment is advanced significantly, and I'm able to not only handle difficult situations that I never thought I would be able to in my own assignment, but I'm able to help my colleagues around the unit. I can see the bigger picture of what's going on.
To me, it means that you're willing to take on more intensive projects that are both hospital, program, and unit-based. To me, it signifies that you're looking at more of the big picture of this. It's not just the patient in front of you that you're taking care of, that how can I do things, how can I help implement changes here in the hospital that are going to make our practice better and will benefit our patients and our families a little bit more.
So as a level 2 in the cardiology clinic, I'm responsible for facilitating peer reviews, not only for level 1s but also level 2.
As far as my practice, I feel a lot more confident in my practice. I have become a charge nurse, I have become a preceptor on the unit, I have taken on a lot of different roles in different committees. I have presented at a conference, the one that was here at Boston Children's Hospital, which was really cool. And it's just given me all these different opportunities to grow within the hospital and within my own practice.
A lot of times when we triage, we have to take the clinical data, make a decision. Should this patient be seen today? Should this patient be seen in an emergency room? Is it okay for this patient to wait a couple weeks? And we have basic guidelines, but a lot of it is clinical judgment that we kind of have to make independently.
I'm personally involved in a handful of committees. I'm involved with unit-based, program-based, and hospital-based committees. I'm unit-based. I'm part of the PI committee, or Performance Improvement Committee. So I take part in audits and trying to track things such as blood transfusion audits, discharged and inpatient chart review audits to see where we can get better with our documentation. Program-wide, I'm part of the Infection Control Committee. So I help educate nurses on the new products that are coming out, on new practices, on new bugs that we may see. And I do audits of our positive cultures that we have here, so I'm able to give feedback to the hospital-wide staff that may not, if we have extenuating circumstances that are the reasons we're having these positive cultures. So I'm able to both relay information from our unit to the hospital-wide committee, but take information from the hospital-wide committee or program-wide committee and bring it to our unit as well. And
there's a level of respect, as well as there are a lot of people that tend to come to me more for things, whether it be administrative staff wanting to know, small questions, or other clinical staff getting your opinion, what you think of, certain patient situations, clinical statuses.
So I am on the Division of Medical Critical Care, their QI committee, so we do a lot of quality improvement initiatives, and subdivisions of that are the asthma SCAMP and the sepsis QI committee. I'm also on our recruitment and retention committee.
I do policy and procedural, I kind of coordinate all the new policies.
So I just kind of felt like at some point there was this shift where I was no longer the one asking questions and feeling unsure about a situation, but I was actually lending my clinical knowledge, and I felt more confident in resourcing my neighbors and other newer staff on the unit.
Hospital-wide, I'm part of the Skin SME committee, so that we, I'm able to introduce and educate staff nurses on new products, new practices, the results of our audits. I'm able to be a resource as far as skincare goes. So I think in my situation, I think I have the benefit of being at all three levels, and it's really when I became involved in all three that I really thought the process of obtaining my level 2 would be a good idea, because I think a situation like that where you're involved both at the bedside but even up to a hospital-wide, I think that's the definition of a level 2 nurse right there.
You know, there's a pride in being a level 2, you know, there's definitely more respect that comes with it, more responsibility, which makes your day-to-day coming into work you feel more fulfilled as a nurse.
So the class was really helpful because they taught me how to make a CV, which I had never done before. They introduced me to a bunch of different nurses from all different specialties that were going to level 2 and what it meant to them, and listening to everyone's exemplars and statements of practice to see what nursing meant to them and how advancing was going to help them further their careers.
The advancement to level 2 class is beneficial, especially if taken early on in the process. I think it'll help you get in the right mindset to start your level 2 process. It'll kind of answer some of the questions that we all have as we begin the process, and it'll help kind of guide you through. So I think it is a beneficial thing for all our nurses to take as they begin this process, and I'd say the sooner the better.
And taking the class really just made it so much easier to go through the process. It gave us the opportunity to read and listen to different exemplars as well as statement of practices to see what exactly the leadership staff was looking for in your statement of practice as well as your exemplar.